Hello, and welcome to Dermatology Weekly, the official podcast of MDedge Dermatology, where we discuss issues that most affect the specialty. I'm MDedge editor Elizabeth Mishkati. And now, your host for this week's COVID Conversations, Dr. Candrice Heath.
I am Dr. Candrice Heath, guest host for the Dermatology Weekly podcast. Thank you for joining me for another COVID-related conversation. For this COVID conversation, I talked to two dermatologists, Dr. Shadi Kourosh and Dr. Maritza Perez, about the impact of COVID vaccine on the field of dermatology. First up is my discussion with Dr. Shadi Kourosh on COVID vaccine preparedness for dermatologists. Dr. Kourosh is an assistant professor of dermatology at the Harvard Medical School, as well as director of community health and founding director of the Pigmentary Disorders and Multi-Ethnic Skin Center at Massachusetts General Hospital. Thank you so much for joining me today.
Thank you, Candrice. Great to be here.
Awesome. So recently you published an article in the International Journal of Women's Dermatology that really addressed the COVID-19 vaccine from an angle that I know a lot of physicians in medicine probably had not even thought about. But you really talked about preparedness for dermatologists. And you talked about reports of patients getting fillers done and having these reactions and the timing between the filler being done and actually their COVID vaccine. So can you talk to us a little bit about, why do you think this is happening?
Yes. In the vaccine trials, we did see that there were some reactions in the skin, and specifically to hyaluronic fillers in 3 patients that were specifically in the Moderna trial. And since the vaccines have come into the general public and public vaccination programs have begun, we've seen a variety of skin reactions, everything from injection site reactions to more widespread skin reactions to more of these filler reactions with a variety of the vaccines. It's thought that it's not just the Moderna vaccine that we are now seeing in terms of the reactions that are being reported to dermatologists and now documented in the various registries that we have for vaccine side effects that are being reported. And it's thought that in most of these cases, it's a non-specific reaction. For example, with the reactions that are seen with cosmetic filler, this has been thought to be an immunogenic reaction. For example, something that activates the immune system, which we've seen before. There's a precedent for those kinds of reactions that have been published in the literature. For example, if someone has a sinus infection or an upper respiratory infection around the time of a filler procedure, or in some cases, dental reactions. A lot of cosmetic physicians, for example, as a part of their counseling before these procedures, will ask patients if they've had a recent infection, whether that's an upper respiratory infection, a sinus infection, an infection with herpes simplex virus, which causes cold sores, for example, on the face, or if they've had a dental procedure, because these events happening around the time of a filler procedure can activate the immune system, and that it's thought that there is possible immune activation in some patients after they receive fillers, either at the time or around the period of their procedure, or sometimes afterward, even months afterward, because the body starts to metabolize and break down the fillers. And it's thought that some of the breakdown products that are still in the skin could be somewhat activating to the immune system. So the idea is to minimize the number of things, the number of factors that are happening in any short period of time so that the immune system doesn't get overly excited.
Oh, okay. That definitely, that's a great explanation. And, when specifically talking about the COVID vaccine, so a lot of our listeners, we have a variety of listener demographics. We have people in academics, we have general dermatologists, we have people in private practice. So is there like a quick way to have these conversations that you can just sort of say, okay, these are my high points when I'm counseling patients who are interested in filler, but also are, concerned about COVID or thinking about getting vaccinated. So are there some things that our listeners can remember to say, oh yes, I must tell them the following things?
Yes, I would say that timing matters, and that, a lot of things can activate the immune system, and vaccines are one of many things that wake up our immune system and activate it. And we just don't want too many things that activate our immune system happening within a short period of time. For example, 2 to 3 weeks. And so what I've been advising all of my patients is that to plan their cosmetic procedures with a good window of time before and after they're planning to be vaccinated. And that the other thing that I think it's really important for everyone in the medical community to keep in mind, and for patients also to be reassured, is that we know what the skin reactions to the COVID vaccines are. They have been documented in the clinical trials. They've now been documented in the literature. So we know what they are. They're generally things that we've actually seen in the past with other triggers of the immune system, even with the flu vaccine. One of the patients in the COVID vaccine trial, for example, that had a filler reaction, reported that she had had the same reaction with the flu vaccine. So I think a take-home message is that there are a variety of different reactions, but that we know what they are and that they're manageable. So the most important thing is that everyone go ahead and get vaccinated, that we as a medical community need to send our patients a message that these reactions are not in any way an obstacle to vaccination, that we still 100% encourage everyone to get their vaccine, but to have these planning conversations with their doctors if they have any history of having lots of allergic reactions to various things. Like, for example, people that had injection site reactions with the COVID vaccine or other kinds of allergic reactions. Allergic reactions have been seen with a variety of vaccines before. Again, this is not something new with the COVID vaccine. And oftentimes when people have skin reactions to vaccines, it's actually not due to the active ingredient in the vaccine. It's not due to anything that has to do with the virus. It's usually due to certain preservatives that are used in the vaccine, which actually exist in other products, be they moisturizers or medicines or other things. And so again, these are not specific problems to the COVID vaccine. There are things that we have generally seen before, at least everything that's been reported so far, and things we know how to manage. And so as long as those planning conversations are had between patients and their doctors, we can be prepared and we can manage any side effects as they arise.
And for patients who do develop some type of reaction, what should the dermatologist do? Is there any guidance as far as public health? Is this something that is reportable? Also, what types of advice would you give for the patient themselves who's having the issue?
Yes, for a patient, if a patient is concerned that he or she may be having a reaction, the first thing that I would recommend is to call their primary care doctor or all of their doctors that are, involved in their care, whether if they've had a filler procedure, they should call their dermatologist or their plastic surgeon or whoever their provider was. And they should also call their primary care doctor to notify them of the reaction. And if they are not able to get in to see their doctor or speak with their doctor in a prompt window of time, I would advise them to go to the emergency room or urgent care center if they feel like they're having a severe reaction, like facial swelling, severe lip swelling, tongue swelling, or any kind of difficulty breathing, for example. And in those situations, usually a combination of antihistamines, topical steroids depending on the type of reaction it is, could be helpful. And then also systemic steroids such as prednisone can be given for the more severe reactions. And in terms of the reactions that have been reported thus far, a combination of those therapies were helpful in controlling them. In addition to getting treated by doctors if it's necessary in the case of certain reactions, I would recommend that patients and doctors work together to report these side effects in the various registries that are available. For example, there is a vaccine adverse event reporting system, and there's also something called vSafe, which is a vaccine reporting system that is run through the CDC. So these are two governmental programs for reporting vaccine reactions. There's also a vaccine registry that is run by the American Academy of Dermatology. So the American Academy of Dermatology actually has a registry online to report side effects of COVID in the skin. So this was widely used throughout the pandemic for physicians to report the skin reactions of COVID, and it helped the medical community learn a lot of what we know today about the reactions of COVID in the skin. Well, now they've opened up another dimension to this registry where people can report vaccine reactions in the skin. So I'd certainly encourage both patients and physicians to become educated about the various registries online to report these symptoms, because this is how we can help the medical community do a better job of learning and taking care of patients.
I think that's a great charge to give to all dermatologists. You know, one day, 50 years from now, we will be looking back. Hopefully, we will both still be here. We'll be looking back and really, teaching and telling other dermatologists, what happened, all of these interesting things that we found out, and how this pandemic, yes, although devastating, actually helped to advance science, and hopefully maybe even helping us to learn more about our field of dermatology as it comes to being experts in the hair, skin, and nails. So earlier on in the pandemic, I was really interested in how people instituted procedures within their practices to keep patients safe, keeping patients separated, and, how are they handling procedures? Were they doing procedures at all? So now that the COVID vaccine has become available, I understand that, not everyone is vaccinated, but because the COVID vaccine now is available and people are taking advantage of it, has it really changed some of those normal procedures? Well, I'm saying normal, right? But some of those COVID related procedures that you kind of had in your office, your policies and procedures about, moving patients in and out, or are you kind of still doing the same thing despite the availability of the vaccine?
Yes, I think that's a great point and a great question, Candrice. And I would say that with respect to procedures, I think that there really was an impact. For example, now that it's important for everyone to wear masks, I think that a lot of dermatologists and plastic surgeons, a lot of cosmetic physicians had to rethink what kinds of procedures they were going to focus on in their practice, and maybe focus on ones that would allow the patient to keep their mask on, during, and maybe focus on treating other areas of the body, or for example, they may focus on procedures that are, quote, non-aerosolizing, procedures that don't generate vapors. So I think that we had to rethink our priorities and our points of emphasis in terms of aesthetics in order to prioritize patient safety. And now that the vaccines have come out, there are other considerations for patient safety. For example, educating people and planning their procedures in such a way to minimize the risk of vaccine reactions. And I can say that a lot of dermatologists and plastic surgeons that I know are now incorporating vaccine counseling in their cosmetic consultations, and in some cases in their cosmetic consent forms, so that patients will read about these potential side effects and be aware of them and be prepared for them.
Well, I think that is a great point to end on. And I definitely want to give you an opportunity, if you have anything in addition to the things that you've said that you definitely want to add, please do so at this time.
Well, I think you made a great point about the historical moment that we're living in, and that it's a real opportunity for all members of the medical community, healthcare providers of all backgrounds, and also patients to come together to really educate people about public health and really band together to help everyone be safe and healthy and get their vaccines. And hopefully our society will come through this difficult point in history safer and wiser as a result of it.
Oh, well, I certainly hope that that is the case. I think, having any kind of positive spin on the current situation to look forward to is definitely beneficial to everybody's mental health. And, from a scientific point of view, sometimes when you have nothing else to say, to look forward to, I think about, well, you know what, there's definitely going to be some advancements in science, that comes out of this period. So thank you so much again for joining me, Dr. Kourosh. I also talked to Dr. Maritza Perez on how the COVID vaccine has impacted her practice. Dr. Perez is a visiting professor of dermatology at UConn, and she is also a clinical professor of dermatology at Mount Sinai in New York City. Thank you so much for joining me today.
I'm very happy to share this time with you, Candrice.
Awesome. So I definitely want to go ahead and dive right into this COVID-related conversation. This is definitely right up your alley, Dr. Perez. So I'm really excited to hear what you have to say. And first, I really want to start by asking you, how has the COVID vaccine particularly impacted your practice? We often talked about, people changing the way they were doing things because of COVID. But now that the COVID vaccine has been rolled out, have some of the procedures that you're doing in your office, either patient flow wise or actual cosmetic procedures, have changed?
Actually, you might be surprised to hear that, I am in both places. I'm in my private practice Monday and Fridays, and I am in UConn Tuesday through Thursday. And you will be surprised to hear that the cosmetic patients really only went away for a little while. They came back almost immediately. There's something about the need to pamper that spirit that they came back. And they came back and the procedures were done. We just have to be very careful because of everything, even as you ask about the impact of the vaccine, even though I'm being fully vaccinated, I still wear the same protective equipment that I wear before. So I have my hat, my N95, shield, my coat. I'm always in scrubs. So my function and the way that I function has not changed. It's just that I feel a little safer because I know that there is less potential for me to die or be severely ill from the disease. But it was to my surprise, and I can tell you from, the first 2 weeks in April when everything was closed till now in the summer, and now, the cosmetic patients really never left. They were constantly calling, and it was just astounding to me.
And do you think that all of this technology where people are using platforms like Zoom and all of these other platforms to stay connected, do any of your patients kind of mention, oh, I noticed this when I was on Zoom? Have you had any stories like that?
No, because most of my patients are not really in Zoom. Most of my patients are the ladies that are home looking at themselves in the freaking mirror. So, it's very interesting. It's like, they're not the working woman that we are. Because to tell you the truth, it took me longer to do my own Botox because I was not aware of what was happening. But this woman have their needs, and they are at home, they are taking care of their kids, and they look in the mirror and they know their needs. And that's one of the things that happen is these are not Zoom people.
Yeah, I think that's a great point. We as dermatologists, we can work in a multitude of just different practice settings, and based upon the community where you work, just the city where you live, your patient population can be so different. So I think that that's one of the bonuses of our specialty.
But I actually
And
have to. But I actually have to tell you that me working in Connecticut make a big difference, because I think that Connecticut from the beginning had it under control. If you look at our numbers, we had very low numbers. The contagion percentage was kind of never very high. And even in our town here in New Canaan, the school system has been open. For the first 3 months, it was closed. It was high. It was a distant virtual. But now the school system has been open. So it's a virtue to have small communities and small states with practical control of the situation.
And do you have patients asking you, oh, Dr. Perez, did you get the vaccine? Are you going to get the vaccine? And how do you handle those conversations?
Actually, I have made myself an instrument of education, because there's so much misconception out there. And, the patients ask me if I have gotten my vaccine, and I tell them that I got my 2 vaccines. I tell them the story of my side effects that were minimal. And then I proceed to tell them that they should get their own vaccine. And I tell them, the option is either you get COVID, which is a Russian roulette, or you get the vaccine, which has predictable outcomes. So, I have made myself the instrument of education for them and try to convince them to get the vaccine. And I have been very successful. There's a few older people. I have, for example, a couple, she's 83, and she's not going to get the vaccine because, she's old, and she's not going to take the vaccine from a young person. And she knows that she's going to die. And I told her, yes, we're all going to die. Okay. But her 93-year-old husband, she has forced him not to take it. And I say, you know what? If you want to get your vaccine, you go ahead. You can, whatever her name is, you can decide not to take yours, but don't force my little man here not to take it. Let him do his thing.
Yeah, I think that's an important point. We in healthcare have been able to have access to the vaccine, the elderly population, and as they begin to roll it out, there will be more people who will become eligible to receive it. So you're right. Some of those people who are at risk should go ahead, and it's important that you let them know that, hey, you should think about this because you are in one of those higher risk categories. So you're really doing some advocacy. So you may be doing a little Botox here or there, but you're also being an advocate as well for the health of your patients. And I really enjoy that.
And the another thing, I don't know if you know that has happened, and it's rare, but it happened to me. He happens to be one of my neighbors in the vicinity, and he's one of my patients too. So he comes and asks me about the vaccine and how the side effects were, and then he tells me, I'm really jealous because you got the vaccine and I have not gotten it. There's this vaccine jealousy now. Come on.
Oh my goodness. Yeah, yeah, you're right. I mean, people do talk about it, and we don't want to run out of it for the people who really, really need it. But so we definitely, it's important to kind of take the measure seriously, to look at what is advised in your area. I think it's kind of hard because every single state may have different parameters for who is getting the vaccine and when. So I can understand how it's creating some angst amongst people, for sure. And in your practice, I mean, you have a variety of patients that you see, and during the pandemic, people were concerned about what happens if a patient in the practice has COVID, you really don't know about it, and then maybe they alert you later. How are you handling these potential exposures? It seems like you're kind of going into the everyday geared up, regardless of what's going on. But did you institute anything specific in your practice about handling these exposure risks?
Well, Candrice, remember that we are from the era of HIV. Do you remember? I remember vividly the era of HIV, and we did not know anything about it. And we decided that universal precautions was actually was not we. It was Dr. Fauci who told all of us that you need to practice universal precautions. So another pandemic comes along, and you just practice universal precautions. So whenever I have had only one instance where a patient was diagnosed with COVID after seeing me, but I was sure that everything was under control because I had all my gears, and the patient was demanded to have all, the mask and the protective equipment. So I feel secure that I have not been exposed. In Yukon, we have, the screening is very thorough. But obviously, you can always think that patients do lie, and patients travel and they don't tell you, or they tell you the wrong thing. And so I've been suspicious that some patients have had exposure and has decided not to share that information. But since I have my universal precaution measures, I even after the vaccine, I still wear my hat, my N95 on my shield, so I feel very safe. I prefer to still feel safe because I'm protecting myself than to just have surprises.
And as a COVID vaccine advocate, is there anything else that you want to share with our fellow dermatologists who are listening, who, work in a variety of settings, both academics and private practice, small town, large towns? Are there any kind of closing words that you want to offer?
I really want to let them know because, I know that there is a very vast diversity in the perception and the risk that each one of us wants to take. I'm obviously mature. My children are mature. If I die tomorrow, I've done everything that I needed and wanted to do, thank God. So I may look at life differently, but I think that if we all look at life like we can do the best that we can under the circumstances that we have, and we protect ourselves the best that we can, I think that this will pass. I don't think that COVID is here to go. I think that we're just going to have to run our lives around COVID. I think that COVID is just not going to go away, but we have to learn how to deal with our lives around COVID, and the fastest we learn how to do that, the better our lives will be, because we cannot be paralyzed and impeded to function as, as the human beings that we are and as the doctors that we are.
Thanks to Dr. Kourosh and Dr. Perez for this COVID conversation. I am your guest host, Dr. Candrice Heath, your favorite fun, board-certified dermatologist, your go-to girl for everything healthy hair, skin, and nails. Thank you for joining me for a series I call COVID Conversations with Dr. Candrice. Until next time.
That's it for this week's episode of Dermatology Weekly. The peer-to-peer portion of the show is produced by MDedge editor Melissa Sears and editor Alicia Saunders. All of our podcasts are produced by Nick Andrews and MDedge editor Kathy Scarbeck. I'm MDedge editor Elizabeth Mishkati, and this is Dermatology Weekly.